Thank you very much for having me. My name is Dr. Kibe Victor Wathugi. I'm an infectious disease specialist, medical doctor by profession, and I work for Nairobi City County Government, the health department in the medical services sector, where I head the division of non-communicable diseases. Currently, the division has 3 units, that is the cancer unit, the mental health unit, and the non-communicable diseases unit, including diabetes, hypertension, epilepsy, among others. I quite recall very well when the first case of COVID-19 patient was reported in our country. We were having celebrations for the World TB Day. And we were in one of our local primary schools where we were trying to do advocacy because TB, is a highly infectious disease. And yes, then there was the then Cabinet Secretary for Health made an announcement that there's been a reported cases and all public gatherings had been suspended henceforth. Thereafter, 2 or 3 days after, we were contacted by the Ministry of Health, a team of experts. We were trained by the Center for Disease Control, the CDC, and luckily I was among the very first healthcare providers to be trained on basic infection prevention measures to try and contain the disease. I recall at that time we did not really know much about COVID-19. We were relying mostly on information from the World Health Organization and also experiences from other countries which had been hit hard by the pandemic by then. So yes, that's how it all started. And I remember at that time when we had very few cases in the country, there was a lot of deliberate efforts, both by state and non-state actors, that is the government and other organizations, to try and see how to combat and at least try to avoid what was happening in other parts of the world. And that made me a frontline responder to the disease. Of course, it was a multidisciplinary team. We had the lab team, we had the public health team, we had people like me, infectious disease specialists, we had epidemiologists. So it was actually a well-constituted team, including the security agents, because they were also players when the pandemic broke. So yeah, and that's how it all started. Initially, my first county where I went to respond was in Garissa County. And then after Garissa, I moved further up to Wajir County. I did several trainings there for the healthcare providers. As information was coming, we were also setting up a curriculum to see that we equipped our healthcare providers and even the general public with the right information. So after that, I moved a little bit to Meru, Homa Bay, and then now with time, the numbers started increasing, and especially here in Nairobi. And I remember at one point, even before the lockdown, we had to evacuate people from their households if they had signs and symptoms of COVID. We were able to test them, send the samples to the national reference laboratories or to Cambridge for that, so that we could get the results as quickly as possible, so that then we know how to respond to the pandemic. Yeah, so that's how it all started, and that's how I got myself into the healthcare frontline responders. It was quite challenging, I must say, because my son was around 6 months old at that time, and I felt I had been exposed because I was dealing with patients, people who had turned positive for COVID. So one of the decisions that I made at that time was to move my family. So I moved my family to go and stay with my sister-in-law. We would do all the infection prevention control measures the gloving when you're handling patients, the masking, the use of sanitizer, alcohol-based hand gloves. But then I still felt that there are people even in the community, not just my family, who I had to protect. And then this meant that there was very limited interactions. If you're not dealing with fellow healthcare providers or the patients, basically, majority of us tried to avoid, mingling with the community because we didn't know to what extent were we contaminated. I remember that time we did not have vaccines, had not yet come. So basically, I would just wake up in the morning, get ready to work. Of course, now we had a team that had been constituted both at the national government and the county level, because not all healthcare workers were responders. We had identified teams of people who had some background training on, infectious diseases or to deal with these cases, because we also didn't want to expose our entire health workforce to the disease. So basically, that's how it all started. And then now the most difficult time came when we had the lockdowns, because we had passes. We could go anywhere. But who are you going to? Because everybody else is indoors. I think the only people who we really encountered were the police officers. The law enforcement are out in the night, but then again, there's nobody, except of course a little bit of movements. Much later is when we started feeling the effect, because at that time we were really committed, we had the energy, we felt we had to do this for our people. It is what we were trained to do, respond in such instances. But I think we started feeling the effects of, that now after the pandemic, because, it was quite a traumatizing time, especially for the responders, because at one time, of course, you were seeing people dying, some very sick, others could not even afford, and of course, not everything was free for everyone. And of course, everybody rushed to the free services at the very onset, which means the bed occupancy was all-time 100%. So you have these patients, they need oxygen support. They cannot afford the private facilities, and our government facilities are overwhelmed. So it was quite a traumatizing time for us. Sometimes we would even go to evacuate patients, and they wouldn't even make it to the hospital. We are called, we have this patient, we get the case definition, we do our assessment, and then we lose them before even they got to the hospital. Luckily, I know and I can confidently say that majority, very big percentage of those people who got sick during the pandemic actually recovered and they are well. Yes, however, we noticed, of course, those people with underlying comorbidities, other conditions were really affected because scientifically speaking, their immunity is already compromised. So they were at a higher risk. They were more vulnerable to catching the disease. You cannot live. So if you have a store, you've exhausted your stock. So the trauma I'm talking about here is more of psychosocial. The mental, that feeling of I'm not okay. Everything is not okay. It's end month. I don't have money to pay rent. And because I didn't work, so I didn't earn a salary. But, this kind of trauma, these are kids, they're used to going to school. All of a sudden, they're at home. And where are they at home? They are just told there is a disease outbreak. And all of a sudden, everybody in the family is wearing masks. For a kid, for a grown-up, it's easier to understand. But you can imagine for a child, they are wondering why all of a sudden is everybody putting masks, everybody is keeping distance, and we are used to, Africa, the way our social cultural setup is that, we bond, we want to hug, we want to hold them close to you. But then this was now not happening. I remember some of our colleagues got sick, and very unfortunate. We even lost some healthcare providers who were in the front line. I remember a case we had at one of our isolation facilities at the Kenya Medical Training College, the Nairobi campus, where several of our staffs actually got sick to the extent of being admitted in the hospital. And now you can imagine, again, like we are talking now, you can imagine the toll it had on the rest of the team. Yeah, but basically, yes, it was quite a tough time. We braved it, so we now started organizing, skits. We would do team building activities just to see that, we are having some safe space, especially for our mental well-being. So we would go hire the public address systems and play some music, dance, charm, do all these things. And also we also started encouraging the community to do the same because the stress was all over. Yeah, so those were some of the things that we tried to embrace, and to date they still work. Because we realized actually we have been having this burnout all along, only that now during this time of the pandemic, it was accelerated. Yeah, I think the disease taught us quite a lot. It also unlocked potentials that people didn't know that they had. For some companies, they realized they had some positions that they really did not need. And then they realized some tasks can actually be done from home. Don't have to, physically be present at your workstation. And it was being effectively done. We even learned during the pandemic, even for our academia, we learned that, we don't have to go to a classroom. You can stay at home and continue learning. So there were those, of course, the pros and the cons of it. But I tend to look at it from the positive side, that we learned that you can do a micro garden in your backyard, and you don't have to buy everything from the markets. And we also learned that probably we were spending a lot of time at work and having very little time with our family members. So those are some of the positive good things that we learned from the pandemic, especially that aspect of having to work from home. And we have embraced it, because even as late of yesterday, I had a virtual meeting. So it also showed that we could, not spend so much resource on physical meetings, because basically, if you want to do a virtual meeting, the much you need is just data, probably on a smartphone or a laptop. And you can meet with someone who is in Mombasa instead of traveling to Mombasa or them coming to wherever you are. One thing that I realized is that when it comes to matters health, it has to start with individual responsibility. Much as this was an infectious disease, the way you responded, your discipline, your self-discipline, determined the risk you're putting yourself. And when you look at it, it's not just for the COVID. Most of these infectious diseases are actually avoidable, unlike non-communicable diseases. And there are usually enough preventive measures that have been put in place. So if I don't protect myself, I'm not protecting you. If you're not protecting yourself, you're not protecting me. So I think the one thing that I really learned is that when it comes especially to infectious diseases, we have individual responsibility to contain the spread of the disease. Remember one thing, the virus does not move. The bacteria does not move. It is us who move the pathogen. Even if I left COVID here on this table by maybe spitting, the virus will stay there. It can't go anywhere else. Even if maybe it could travel maybe a meter or so through a droplet, but it cannot go beyond a meter. Okay? So it stays there, literally. It can't go. But if as I move, I am moving the virus. So basically, in one word, I would say it's all about responsibility matters health, and especially infectious diseases. I kept telling people during that time that, there's this thing that we were taught since we were almost a week old, a month old. You will see the way we hold the baby and wash their hands. And we go back to the lower primary. We are taught when to wash hands. We go to the upper primary. We are taught to wash hands. Okay? And now we are graduates. We are still being taught to wash hands. What does that tell you? It's about personal responsibility. People kept challenging us, especially us who are in the medical field. Whenever you'd go anywhere and people know who you are, they will ask you, Daktari, are you sure? Can you explain to us? People even would go to the internet, do a lot of research and come and challenge us. This thing is, but I think when we talk especially with infectious disease, we try to focus more on something we call health promotion and prevention, which deals a lot with advocacy. And I think that's where not just our country or Nairobi, generally the way we do things in Africa, if I would say, we tend more to use threats. We don't take time to explain to people. If I tell you to stand 1 meter away, why? You see, that bit doesn't come out properly. One morning, everybody is told, if you do not have a certificate, you cannot enter a restaurant. Why? We need to tell the people the reason. Explain further. Why is it important to wear a mask? But you see, our narrative was, from tomorrow, everybody, mask. No, and that's the bit now I'm talking about some of the gaps that we realized was in advocacy. We were not telling people, so what does it mean when we say you cannot meet in a barrio? We have to limit. I think that's the missing. It's not that people are very difficult. It's just that in most cases, you'll come to my hospital or wherever, I'll tell you, turn around, pull down your pants. I'm not even telling you what I'm doing. So what will you feel? You will do it, but I think that is the bit that made people a bit resist the government policies that were in that place. It didn't come out clearly. Why are we doing ABCD? We were just telling people, do ABCD. And then, of course, even the people who are saying those things to be done are themselves not practicing it. So why would you expect me to believe you? You're telling me to do ABCD, and then the next thing I'm hearing, you are the person doing the contrary. Yeah. Okay. And then, of course, there's the other bit that was not taken also into consideration. These things come at a cost, which you are not prepared for. Number one, you are out of job. You are locked in your house. And then you are being told, you need a sanitizer, you need a mask, you need what. So, we also needed to have looked at the availability of this thing. I remember there are times a mask would cost 100 to 200 Kenya shillings. And they weren't enough. So you had to call and look, and where can I get one? So those are some of the factors that I think made the people a bit hesitant to, taking up the government directives. Okay, there is one that, because now, like I mentioned earlier, I was in charge of isolation and quarantine. And this involved both locals as well as international travelers, and even people who found themselves sick and within their household or at their workplace. And remember at the very beginning, it was mandatory. It was not optional. If you had contact with a positive COVID patient, you had to take a sample, which was not optional. If the sample turned positive, if the test came out positive, you had to undergo mandatory isolation. If the test came out negative, you had to undergo mandatory quarantine. Okay? And what I learned, or rather what I experienced, that was the most difficult time. And that's why it gave us, as a country, a very hard time. Because then in that case, even if I came into contact with a positive COVID patient, I would not self-report, which is what would be expected in a okay. It is expected that if I was with Dr. Matu and I knew I'm positive, I'm supposed to disclose to him and tell him, look, my brother, I have tested positive for COVID. But you see now, because of the way things were, mandatory at your own costs, you have to pay, it made people, shy off. Let's take an example of HIV today. If you get exposed to HIV, you quickly run to the nearest health facility and self-report and say, oh yes, I think I slept with somebody and I'm not sure of their status. Would you please, would want to take some tests and also some preventive measures? Yeah. You see, it's self. It's not coerced. And that makes it easy in controlling HIV. Because if you feel you're at risk, you opt for the tests you actually present yourself. We don't even come looking for you. But in this case, the story was different. My question is, how involved was the community, the people we are protecting, when you're making decisions? Do we sit in offices like this one, make decisions for people in Kawangware? Why don't we bring the people in Kawangware, we sit together, we agree this is how we are going to do? Then that way it becomes palatable and more acceptable. Remember, in the society we have gatekeepers, the church leaders, community elders, the mosque, the imams at the mosque. We need, in the event of another disaster, we need to involve the people who we are trying to protect. Let them give us their views, because this is a country which has very diverse cultural systems. You go to Isili today, or for 1 week, and then you go to Kawangware. Those are two different countries within a radius of 40 kilometers or less, with very different practices, very different way of doing things. So if for example you're targeting the people in Isili or Kamkunji, the way you package is different from the way you'll package for the people in Kibra or for the people in Kare. But you need to involve those people. One thing I learned during the pandemic, and it's always been said, everybody wants to go to heaven, but nobody wants. During the pandemic is when I realized there is no rich and poor. We are all fighting a common enemy. It didn't matter how much money you had, because even those who had loads and loads of money, even head of states, we lost them to COVID, with all the government resources and all their wealth and everything. So for me, the question would be, how involved is the community in decision making? Is for people to remember that the responsibility starts with yourself before going to others. So the responsibility starts. If I don't protect myself, I'm not protecting my family, and I'm not protecting my colleagues. I'm not protecting my friends. So it has to start with self-care.